So thanks everybody for turning up, and I'll hand you over to Frank for his session on medical imaging.
Thank you, Ruth.
No worries. Okay.
And as always, if you could mute yourself unless you are asking a question, please.
Well, as we've already said, good morning to everybody and welcome. And this is a repeat of a presentation I did 2 years ago now, but it's not a bad one. I have pruned it down just a little to accommodate Zoom and the fact that we can't actually be face-to-face, which would be much more desirable, but anyway, that's the circumstance. This is a little jaunt through medical imaging and the story of it. And in fact, the story of medical imaging is much shorter than you might imagine in real terms. So let's go and we'll have a look at what happened. Now that didn't work. Why didn't that work? Okay.
Won't go on to the next screen.
It won't. No.
Sometimes you have to actually go back to your slideshow.
Right, let's try again. Here we go. Good. Okay, now the whole thing about medical imaging is that it uses wavelengths that we can't see. And I put this particular slide in just to show how small in the whole electromagnetic spectrum visible light is, and that's a tiny little bit in the middle. And so we can see that above that we have ultraviolet and X-rays and gamma rays, pardon me, and below that infrared, microwaves and radio waves. Now, radio waves have become very, very useful in more recent times, and we'll deal with that when we get to it. Microwaves, of course, are well known, microwave transmissions, microwave ovens, and so forth. And infrared is actually being used these days as a new method of space heating. Rather than heating an environment, you actually heat people. Interesting concept. Ultraviolet, of course, is known to cause skin damage. X-rays are known to cause carcinomas. And yet here we use X-rays in order to see these things and view them and indeed diagnose their presence. Gamma rays are particularly nasty, and we won't go there, but except to say that some of the very old television sets, the old black and white sets, were notorious for gamma radiation from the screen. And so sitting too close to them was considered, quite understandably, fairly dangerous. So we only see this little bit of visible light, but the other wavelengths are incredibly useful. And so we use them to great effect in medical diagnosis. Now, medical imaging has been around only since the late 19th century. From that time, so many new techniques of medical diagnosis have been developed, but it all started really fairly early on, or late in that 19th century. It's not all that long ago in real terms. These new methods of diagnosis that have been developed enable a huge range of conditions which were previously unknown to actually become known and become diagnosed and therefore able to be treated. And so the discoverers of these particular methods of diagnosis are owed a huge debt of gratitude for their pioneering work, which has been very, very extensive. The whole story really starts with this stuff, pitch blende, and it is a fairly interesting substance. I'm sure Joe would know a lot more about pitch blende than I, but it is one of the forms of uranium oxide or uranium dioxide, a mineral called uraninite, and it contains, among other things, uranium. The other form of uranium that is commonly mined is U3AW, which is uranium oxide, and that's what's mined in Australia and other countries. But this stuff was found to contain uranium and also polonium and radium. So developments have come from there. And deposits of pitch blende, as you can see from the information here, are found quite widely around the world. So fairly common stuff, but one of the ores of uranium. Now, William Conrad Röntgen, after whom the units of radiation that are measured are named, a German physicist, and in 1895, in fact on the 8th of November, as information tells me, discovered X-rays. And the image on the right in this, even though it's been coloured, is of what turns out to be his wife's right hand. It was initially thought that it was her left hand, but when you do a little bit of examination of this figure and know a little bit about skeletal anatomy, you can actually determine that it's the right hand. And with her wedding ring, if this thing will work on the screen, can you see that's her wedding ring. And
the only thing that will work on the screen, Frank, is your cursor. Yes.
Okay, so this thing here, okay, is his wife's wedding ring. And it is an X-ray of her right hand. And whether this was by accident or by design is still in dispute. Anyway, it happened, we have it, and this is known as the very first X-ray, 1895. So this is really when medical imaging had its beginning, had its genesis, and it's all taken off from there. But you can see, it's 1895 is not terribly all that long ago. It's comparatively recent. When we talk about history being, hundreds and hundreds of years old, this is actually fairly recent in real terms. So let's have a little look at this medical timeline, which, as we mentioned, started in 1895. And the Curies, Marie Curie in particular, became fascinated by the work of a French physicist named Henri Becquerel. That's a lovely name, isn't it? And his discovery that uranium emitted rays weaker than X-rays was quite amazing. January 1896, X-rays, which were initially a novelty, they thought, oh, here was a picture, we can take a picture of somebody's hand, we might take a picture of the body and show the ribs and so forth, bit of a novelty. But it started to become widely used around the world, simply because it would enable pictures to be taken that weren't seen before. And you could start having a look inside a body, which was fascinating. In 1898, the Curies discovered new radioactive elements out of pitchblende, and they called it polonium, after Marie Curie's birthplace of Poland. They also detected the presence of radium in 1902. Now, radium's quite interesting because I guess an offshoot of that, radon, is a water-soluble radioactive compound. And when I worked in Queensland, there was a deposit of mineralisation not terribly far from Townsville, and the water supply, they contain fairly high quantities of radon. So interesting. In 1903, the Curies and Henri Becquerel were awarded the Nobel Prize in Physics, and Marie Curie was the first woman ever to be awarded that prestige. Now we take quite a quantum leap. Here we go, as you see, from 1903 to 1946. So in that 40-year period, not a lot happened in real terms, except one could say probably the refinement of X-rays. However, we had American physicists discovering independently, as it turns out, two American physicists discovering nuclear magnetic resonance. And this was a bit of a buzz around the medical diagnostic fraternity, because it was new, it was exciting. What did it mean? And in this photo here, this is actually a nuclear magnetic resonance spectrometer. So it's quite a bulky piece of equipment in real terms, and maybe not necessarily the kind of thing you'd like to have in your living room. But anyway, there we go, there it is.
Frank, can I interrupt to ask?
By all means.
I'm just interested that in the period of the Curies up till 1946, there were two world wars, and I'm just wondering, was X-ray, the discovery of X-ray, used in any way in weapon development or during those two wars?
I can't answer your question definitively, Joe, but as far as I'm aware, no. But there are lots of things that went on behind the scenes in both those wars that we will probably never know about. So it is entirely possible, but not that I've been made aware.
Okay.
No worries. Thanks. So in 1952, the Nobel Prize in Physics was awarded to these two American physicists, Edward Mills Purcell and Felix Bloch, for their discovery of the new nuclear magnetic resonance machines and other related discoveries. And one of those, you might be thinking, does this have anything to do with MRI? Well, you're absolutely right, because it does. It's the forebear, if you like, of MRI, magnetic resonance imaging. In 1955, ultrasound started becoming on the scene, and Scottish physician Ian Donald started investigating the use of ultrasound to diagnose gynecological problems. And as we know now, ultrasound is used quite extensively, not only for that purpose, but for other things that that are particularly in the abdominal cavity. Kidneys can be examined with ultrasound for the presence of kidney stones, bladders for what's called urinary gravel, or indeed for polyps and so forth. So this was, again, a new and exciting development in medical imaging. 1957, fibre optic technology started becoming more and more refined, and then with the use of this technology by this gastroenterologist Basil Hershevich and his co-workers at the University of Michigan, and they developed a fibre optic endoscope. And of course, we know what the development of that is. We have gastroscopy and colonoscopy performed using these fibre optic endoscopic devices. In 1958, Ian Donald published a definitive paper, it's his seminal paper on medical diagnostic ultrasound. And from there, he turned his attention to obstetrics and investigating the growth of fetuses during pregnancy, and ultrasound images, which we'll have a look at. We have one to show you later on in this presentation. There's sort of the second part, in real terms, examples of medical images. In 1960 now, the first use of endoscopes used to examine the stomach of a patient, and here we know that this gastroscopy and of course colonoscopy as a spin-off as well. Up to 67 now, CT scanning was conceived, and this fellow, Geoffrey Hounsfield, quite an interesting bloke. There's quite a lot of information about him, and he conceived an idea using X-rays and computers, which of course were coming into their own around that time and really becoming quite commercially available and more refined. And he figured that if you combined the use of the images from X-rays and computers and put it all together, you could get a much better image. And he called it computerized axial tomography. And this is why these scans are still often referred to as CAT scans, but they should be correctly referred to as CT scans, computed tomography. And these CT scans are actually much more detailed and give a lot more information than a regular X-ray. So this was very, very exciting indeed. And as you can see from this image, the early 1970s, which is shown here with his first CT scanner. Now, you'll notice here that the aperture is particularly small. So these early scanners were really only used for scanning heads and brains, in fact. However, from then on, they became larger, the aperture became larger so a body could fit through, and so we had then the extension of this to examine other parts of the body other than the head. So, but very clever people indeed. Here we have a modern CT scanner. I'm sure many of you will be familiar with it, I am too. Not particularly pleasant things to be in, but anyway, there we go. In the early 70s, NMR, nuclear magnetic resonance, was used for detection of cancer. And it was discovered that cancerous tissues and normal tissues produce different NMR responses. And as we've said already, this discovery went further, and we had the development of MRI from that. In 1971, the first CT scan of a patient's brain was performed, and we had the first CT scanner installed in a hospital in Wimbledon in England, and this brain scan was performed on the 1st of October 1971. So it's very, very recent indeed, the use of these technologies. Very modern stuff. In 1971, MRI started to make an appearance, and the American chemist Paul Lauterbur produced the first MRI image using nuclear resonance data from nuclear magnetic resonance and the computer calculations from tomography. And so another very, very clever person, but you see 1973, it's only less than 30 years ago. And it is absolutely incredible, the work that's been done in a very, very short space of time. And the work of Lauterbur made the development of MRI possible, and he won the Nobel Prize in 2003, which is quite a gap after some of the work that he did. However, better late than never, eh? In 1974, we saw the development of PET, which is positron emission tomography. PET, American chemist, development physicist Michael Phelps, not to be confused with the swimmer. He used his system for the first whole body scan and for human and animal studies. So it's quite interesting. PET is a little curious. I did have some information about it. It's quite complex, so I've actually deleted it from this slideshow. But if you want to find out how PET works, go for your life. Now, this is interesting, this thing here, the first MRI body scan. Now, this is the scanner. This is the patent diagram for the scanner. There's very little other information revealed about this, which is a shame because it's darn interesting. And I would like to know how on earth the patient actually ever got into the machine. So there must have been some opening somewhere for the poor sod to get in there. And it was all done standing up. Can you imagine having an MRI scan standing up with all that noise that goes on with them now? Amazing. However, here it is, the patent diagram for the very first MRI scanner. And I couldn't even download this picture. I had to take a camera shot on my computer screen in order to get this image. So it's a little bit poor, but anyway, it does the trick. This was developed by American doctors, Raymond Damadian, Larry Minkoff, and Michael Goldsmith, the first body scan. And as you can see, Raymond Damadian, this fellow here, this is his patent diagram for his MRI scanner. So again, 1977, very, very recent, amazing. So much has happened in a very, very short space of time. After that lull, that quite big lull, 30, 40 years, where nothing much seemed to happen except the refinement of X-rays, all of a sudden we had this explosion of new diagnostic techniques. And it's been quite mind-boggling, to say the least. In 1979, Godfrey Hounsfield, now Sir Godfrey, and Alan Cormack shared the Nobel Prize for their part in developing CT scanning, computerized axial tomography, now called computer tomography, as we mentioned. In the early 80s, MRI scanners have started to become installed in major hospitals. They're humongous pieces of equipment, and as you know, or as you may know, the magnetic source has to be like a couple of floors below where the actual scanner is, simply because there's huge amount of magnetism that's generated. Pardon me. So it would upset all sorts of instrumentation, having a magnetic field like that too close to other sources. So the magnetic field, or the magnetic generator, is isolated and insulated from our surrounding equipment, and fed into the scanner, which looks very much like a CT scanner, but uses magnetic resonance imaging instead.
So, Frank,
Yeah.
what do they use for insulation? Is it lead, like X-rays, or what's the go there?
No, the containing a magnetic field is much easier than X-rays. X-rays, of course, need to be lead and so forth, which is very dense. Magnetism is somewhat easier. A good solid timber and some thin metal will actually do the job quite nicely. If you think of loudspeakers, for instance, they are magnetically isolated. If they weren't, the magnets on the larger low frequency speakers, the woofers, would actually tend to upset other equipment. Good solid medium density timber actually is very good in containing magnetic fields.
Cool.
Yeah, no worries. Thanks, Cole. Now we take a little leap up to the 1990s. Prenatal ultrasound becomes a routine practice. And checking the baby's development, picking up any abnormalities, quite well done. These days, ultrasound is quite refined. The pictures that come from it can be astonishingly detailed, quite brilliant, in fact, and very exciting for couples going through this fetal development process. In 2000, Time magazine named the PET-CT scanner the medical invention of the year. I've never quite been able to work out what gives Time magazine the rights to actually do this, but anyway, they did. And I guess in real terms, this scanner is worthy of such an award. The PET-CT scanner, we're going to talk a little bit more about that when we get onto some of the medical imaging. We've got a PET scan to look at there. In 2003, Paul Lauterbach, who we mentioned just a little while ago, this fellow here, okay, and Sir Peter Mansfield shared the Nobel Prize in Physiology for their pioneering MRI work. And MRI has become really big. It's still fairly expensive because the equipment, being absolutely massive, is extremely expensive indeed. But they do a very good job, these scanners, and the detail that comes from them. We will see an example of an MRI scan as opposed to a CT scan or an X-ray of the same portion of a body in a little while. So here we come now to examples of medical imaging. And first, good old X-rays. They're still widely used as, I guess, a primary radiological technique. The problem with X-rays is that they don't show a lot of detail in real terms. So, pardon me, solid structures like bones tend to show up fairly well because they block the X-rays. Even a heart in this particular image here, this is the heart in the chest, just behind the sternum. The heart shows up white simply because it is very dense muscle and is full of blood, hopefully. So it also shows up white. Lungs, on the other hand, which are full of little bubbles full of air, show up black simply because the X-rays pass right through them. So as far as detail is concerned, ordinary X-rays are fairly limited. But they are still useful, I guess, as a primary look to see if anything abnormal is happening. In the old days, you had X-ray films on huge plates, and some of these are still used, but these days most of it is done digitally. Although the radiation source remains the same, the plates are all digital, it's fed into a computer, and you get amazing pictures much more quickly than from the old days where the plate had to be developed, just like film. So it's come a long way. A mammogram is a specialized X-ray, but again, being an X-ray, the amount of detail available is comparatively limited. But here we have a breast lump. It may or may not be cancerous. It looks a bit nasty because of its rough edge. So I would be inclined, if I were diagnosing, which of course I don't, but if I were asked, let's put it that way, I would say that this lump is probably cancerous. The mammogram can find changes that are too small to be felt with physical examination. So as most of you girls will know, screening mammograms used to check for breast cancer in women who are asymptomatic. And little description here, during a mammogram, the breast is pressed between two X-ray plates. Now this is again curious because the very radiation that's used to diagnose the presence of these little lumps and so forth is also the kind of radiation that can give you cancer. So it's a little bit of a catch-22 in many terms. However, there we go. I think the last line here, about the screening technique can be uncomfortable, but only takes about 20 seconds. Obviously written by a man. Anyway, we'll pass on.
The idea of it can be uncomfortable is unnecessary, I think.
Yes, absolutely. Yeah, yeah. Now here we have a bone densitometry scan and bone mineral scan. Bone densitometry is really quite interesting because you can see in this how good the quality of the bone is. Now this one is false coloured, and I freely confess that I don't fully know how to interpret bone density scans, particularly when they're coloured. The black and white ones are much easier. However, if you think about X-rays, because it is based on X-rays, and the limited absorption of the tissues by the X-rays and the blocking therefore, you'd have to say then that the white areas here are the most dense and the green areas are the least dense. And this would seem to be logical in real terms. So it is a special type of X-ray. It provides information of the fragility of the bones and whether, therefore, fracture is more likely to occur. So the greater the density of the bone tissue, the less likely there is likelihood there is of fractures. Routinely, the lumbar spine and one or both hips are scanned. The bone densitometry scan actually uses a very low range radiation. So this is why the radiographer is actually in the same room as the person being scanned. No great precautions in real terms, except a lead vest isn't required, you know. So if the lumbar spine is unavailable for whatever reason, there may be metal rods and screws and things in there, or bone glue, then they're likely to use a hand or a forearm or wrist as well as a hip. So there are various options when it comes to bone densitometry, and anyone who's had one, anybody besides me had a bone mineral density scan? No? Okay. Well, there you go. Anyone who's at risk of osteoporosis will probably require a bone density scan somewhere along the line.
Well, Frank, that brings up the question of calcium tablets. Do they work? Are they worth taking?
Well, that's a really good question, Cole. And I think the jury's probably still out. One of the risks, of course, in supplementing with calcium is that ultimately the kidneys have to excrete any excess. And if you're taking too much, and some people do, then you're at much greater risk of things like kidney stones as a result of your calcium supplementation. If you eat the right foods, and they're grown yourself or organically or from good quality suppliers, then you're unlikely to need mineral supplementation in real terms, because your food being good quality will have sufficient levels of these contained in them. So if in doubt, then some supplementation may be advised. The form of the calcium, though, is also very, very important. The body preferred form is what's called tricalcium phosphate, sometimes called a calcium hydroxyapatite. And I'm sure Jo will know something about that. She's gone at the moment, probably to make a cuppa. Tricalcium phosphate, because that's basically what bones are made of. So this is the body absorbable form of calcium, whereas ordinary calcium carbonate is not very, very poorly absorbed by the body. It has to be modified, converted, in order to get any absorption from calcium carbonate at all. So don't go eating chalk, won't do you any good, but tricalcium phosphate will. Okay?
Cool, thank you.
No worries, yeah. Angiogram, I haven't had an angiogram. My heart apparently is in good enough nick not to need one. But these use special dyes, radiopaque dyes, and a camera called a fluoroscope to take pictures of blood flow through arteries, particularly in coronary circulation. Now, this area where the arrow is, it's not actually pointing to this artery here, it's actually pointing to this bit here. So the arrow is not in a very good position, but there we go. So you can see here that this is a bit of an issue here, and the blood flow not only through here, but through this is becoming a bit problematic. But here, the blood flow is completely blocked, probably by cholesterolemic plaque, which is the most common. But the angiogram will actually show this because the radiopaque dye flows with the blood through the vessels that are not blocked, but not, of course, through vessels that are blocked. So you can see very clearly there is an issue here, and this would require some intervention, either a stent or surgery, bypass surgery, in order to rectify this blood flow problem. If this is not addressed, where's the cursor gone? There it is. If this issue is not addressed, then the tissues further down the line will start to die. And if that happens, you're in real strife. So as we can see here, the iodine dye, contrast material, then injected into a vein lower in the body, or in the groin femoral arterial vein, or in the brachial artery, just above the elbow here. Brachial artery runs through here. That's the one that you can feel the pulse for in your elbow. And away it goes up to the heart. So interesting diagnostic technique, not too invasive in real terms. There we go, but very useful. Something similar to this is intravenous urography, where again, radiopaque material is introduced into the bloodstream. This also known, as you can see, as intravenous pyelography. It's a wonderful name, isn't it? This again uses X-rays to produce an image in conjunction with an opaque dye. So these show up, and in this particular instance here, right here, is a significant kidney stone. Now, this stone here will be, I would say, impossible to pass. Here, this is the, where's that thing gone? This is the ureter, which takes the urine from the kidney to the bladder. And the ureter is actually a very, very thin tube. They're only about, at the best, somewhere between 4 and 6 millimeters in diameter. And I don't think that stone is going to pass through a tube that small, because the actual aperture in the tube, because there's 3 layers of muscle in the wall of this, even though the tube may be up to 6 millimeters in diameter, the actual aperture of the tube is only about 1 to 1.5 millimeters. So very, very small indeed. So it's designed for liquid, not solids. So this is an issue. This stone would probably need to be shattered with ultrasonic sound waves, broken up into little pieces, which will then be passed agonizingly through the ureters to the bladder and then excreted from the body, again, excruciatingly through the urethra. Not pleasant, I would imagine. Something I don't want to experience. I'm sure you
tried that and didn't like it.
What's up? You had one?
I say, yeah, Reese has too. Reese and I both tried it and didn't like it. Yeah, it hurts. It really hurts. More than childbirth, Reese says.
Yeah, yeah, yes. Look, I've been told that. And I can only imagine what that must be like. Something I have no desire to experience. Righto, I'm moving right along then. Again, using radiopaque materials, barium contrast X-ray. These are still used and fairly unpleasant, I believe. This particular occurrence here shows a cancerous growth in the ascending colon. Now, you might look at this and you think, good Lord, those intestines are all over the place. Why is it that in textbook diagrams they show very nicely an ascending colon? Lost that bloody mouse again. There we go. Ascending colon going up here, and transverse colon going across here, and descending colon coming down here. That's what happens in textbooks. And it might be what happens when you're lying down. When you're standing up, moving around, the intestines are kind of wandering all over the place. And so it's not surprising then that you get an image like this of intestines, and you think, crikey, it looks like an absolute dog's breakfast. But anyway, there we go. So this material, this barium contrast material, has to be swallowed. And I believe, well, from my sister Marcia, who had one years and years ago, that the stuff is absolutely disgusting to chug down. Then you have to wait a while until it gets through into your intestine. And that can be up to 8, 10, 12 hours after you've ingested this stuff. And then you go and have the X-ray taken to show the presence of something like this. And then I'm told also that when it comes to excreting this material, well, not to put too fine a point on it, it was described as a bit like squeezing toothpaste from a tube. I'll leave that to your imaginations. It sounds gross. However, a useful technique in diagnosing cancers higher up in the digestive system. Now you might be thinking, well, why can't they use a colonoscopy? Well, you'd need a damn long one to get around to the ascending colon, which travels up the right side of the body above the appendix. So quite a way away from where you'd normally have a colonoscopy. Okay, this is a CT scan of the lumbar spine. These are the lumbar vertebrae, L1, L2, which you can see is an absolute mess, L3, L4, L5. You can also see here that the discs are in fairly sad state. You can't see a lot else in real terms. You can't get a lot of the definition of the surrounding structures. Again, the soft tissues tend to allow X-rays to pass through. However, this shows more detail than a regular X-ray does. So it's a much more useful image in real terms because you can get a bit of a look inside the tissues. Now here, you might be wondering what this big blob is. You can say, oh, that's a really, really dense bone there. Well, it's not. In this particular case, a vertebroplasty has been performed on this L2 vertebra, basically to glue it back together because there were crush fractures within the vertebra. This is why it looks a mess. And this material is very, very dense and actually blocks X-rays. So it shows up white. It looks like nice dense bone tissue, but it isn't. It's actually bone glue. Sounds exciting, doesn't it? So with this, we have with CT scans, there are X-ray tubes and detectors on opposite sides, and inside the CT scanner, the cameras spin in a ring, in a spiral ring. And I wish I'd been able to find a 3D scan. I was given some years ago when I was teaching. One of my students broke a wrist when he fell off a horse. And so he gave me his CT, a CD of his CT scans, and I've got it somewhere. I've looked, I can't find the darn thing. But the 3D composite that they can make from this is very, very spectacular indeed, because they often use false color as well. So I've got to find it, and when I do, I'll share it with you because it's pretty darn interesting. However, CT scan here of a lumbar spine. CT scanners, as we mentioned, were first installed in 1974, and patient comfort is a huge thing these days. Because these scans can be done quite quickly, then the use of them has become much more prevalent, and again, very, very commonplace in order to get a more detailed view than you would just from a regular X-ray. We're going to stick with this particular part of the lumbar spine for the time being and have a look at an MRI scan. Now, this is the same area. Okay, here we go to L5, L4, L3, L2, the daggy one, and L1. So here we can also see surrounding muscle structures and soft tissue structures, connective tissue that you can't see in a regular X-ray, and even doesn't show very well on a CT scan. If we just do the comparison, see here's the musculature and the soft tissues, not very clear, but in the MRI scan, quite detailed. What the MRI scan doesn't do, though, is show you what's inside the bones. So you can't see the bone glue that's inside L2 here, but you can get quite detailed information on how the vertebrae are faring. In this case, not particularly well, and indeed the discs, which are almost non-existent in this region here.
That wouldn't be your back, would it?
Well, Yes, it is. Yeah, it's that's why I often describe it as being a bit of a train wreck.
Yes, indeed.
Yeah, it is. Yeah. So yes, guilty as charged. Okay. Moving on now, we mentioned PET, positron emission tomography, and this is an interesting contrast scan. Again, this radiopaque material is infused intravenously, and the contrast material emits positrons, which are positively charged particles. Again, they're detected by a detective camera or receiver, if you like, and fed into a computer to make a picture. Now, the PET scan doesn't reveal much about the tissues themselves, but can reveal where potential tumours or other tissues, defected tissues are located. In this particular case, we can see that this area here is significantly different from the other side of the brain. And this is because the tissue here has been destroyed because this person had a stroke. So this is why the PET scan can be useful, because it shows the areas that have been affected significantly by this event. PET scanner runs on the same principles as CT scanner. So you have emitters and receivers on the opposite sides of the scanner that are used then in a computer to produce these images. And they're pretty damn fine, quite amazing. In radionuclide scanning, again, a contrast material is introduced, pardon me. This is the liver, and it's actually in good condition. You probably wouldn't guess that from the scan in real terms, but the liver is quite an interesting organ and probably worth a talk in its own right, because it's so interesting and the way it's structured. It's very, very dense, and therefore absorbs a lot of this contrast material, which then shows up clearly in the scan. These are used to identify, particularly in bones, areas of excess bone turnover. Now, this can be problematic. If there's a lot of bone turnover, then there is an issue in the bone itself. There shouldn't be massive turnover of bone tissue. So if bone tissue is being destroyed at a rapid rate, which necessitates the rapid regrowth of bone, then clearly there's a problem. Maybe some sort of osteosarcoma or something similar, but it needs to be investigated. These kind of scans are also used for thyroids and issues in the gastrointestinal tract as well. So quite useful, but again, they can only measure extent of inflammation by assessing movement of blood flow and food flow in the gastrointestinal tract. So a little bit limited in real terms, but interesting nonetheless. This is called SPECT, single photon emission computerized tomography. That's a mouthful, isn't it? Again, like the scan we saw earlier, this one, the PET scan, in this particular scan, a lot of detail is not present. However, you can get an idea of things that are going on. So it integrates two technologies, CT and radioactive material. And again, the combination of these can produce this type of image. Before a SPECT scan, you're injected with a chemical that is radio labeled. It emits gamma rays. Now, the gamma rays we mentioned earlier on can be quite dangerous, but in this particular case, the gamma rays are detected by a receiver and then translates them into two-dimensional cross sections with the CT scan. And what we have here, in this area here, which, as you can see again, is different from this area here. This is believed to be revealing that this person is experiencing a migraine attack, which often results in altered blood flow to an area. So you can get 3D images from these. I haven't seen one, but I'm told that they exist. But the 2D one it's quite interesting, quite pretty, really. But again, lacking a lot of detail. So you get much more detail from regular CT scans and MRIs than you would from these type of scans. But you can't see a migraine happening in a CT scan, but you can with one of these. So quite useful in their own right. Ultrasound, as we mentioned earlier, used very, very widely for a huge range of things. Here we have quite obviously a fetus. The facial features are very, very obvious indeed. So extremely useful indeed. Now, high frequency sound waves are used to create images inside the body. There was a lot of speculation early on that if you used high frequency sound waves, that you may cause damage to the fetus. This has now been disproved. So used extensively from fairly early in a pregnancy right the way through almost to childbirth. So you get these echoes when sound waves are used, and again, fed into a computer to produce the image. Very, very clever indeed. The scans are used to evaluate fetal development later on. As the fetus develops more and more physical features, you can clearly see from an ultrasound scan if there are abnormalities occurring, and therefore intervention may be required. Certain types of biopsy can also lead to abnormalities. Amniotic fluid examination, for instance, can also be used to diagnose potential problems with the fetus.
Can I just say something?
Sorry?
Can I say something?
Yes.
Yeah, I'm just really interested and fascinated by the computer technology and the medical instruments that would have fallen in behind all of this this X-ray progress to actually do those operations, knowing what was inside the body, and having to develop something, the tiny, weeny little instruments and cameras that are used for certain operations and to look at things in the body would probably have all followed along with those X-rays, I wonder.
Oh, absolutely. Look, the development of X-ray technology, not all that long ago, has really led to all of this.
Yeah.
In a very short space of time.
Yeah.
And it is absolutely mind-boggling the rate at which this development's occurred.
That's amazing.
Really quite incredible, yeah. And often now with computers, also the use of computers with fibre optic technology, again, and fibre optic cameras. Now, some years ago, would only be, less than 15 years ago, Sony developed a very, very small fibre optic camera. And this again was used then in a gastroscopy. And this is what's used now in the endoscope to actually illuminate. It carries its own light source. You've got a camera and you can actually physically see the tissues.
Yep.
And it is just extraordinary. It has come such a long way in such a short time. It's absolutely mind-boggling.
My brother had an operation, had a small procedure done on his heart some years ago, and they performed the procedure through the groin. He had a local anaesthetic, where they sort of deadened that area in the groin.
Mm-hmm.
They fed the little tubes up through into his heart. They did the small procedure. And he went in at 7:30 in the morning, and he was back in his hotel room at 3 o'clock in the afternoon.
Yes, yeah, it's remarkable, isn't it?
Awesome, yeah, it's amazing.
Yeah. Well, these days, using these techniques and also using high frequency sound waves, people who are experiencing atrial fibrillation, this fibrillation may in fact be due to the presence of extra sensory cells, additional sensory cells in the atrium of the heart, when the sinoatrial node emits its impulse, it's designed to be picked up by the atrioventricular node, but there are also sensors within the wall of the atrium that actually cause the atrial contraction to ensure that the ventricles below them are full. Now, if you have too many of these cells causing this atrial contraction, not only will the atrial contraction be too hard, but it may in fact be the cells will be receiving the impulse at odd times, and so you get this quivering, this atrial fibrillation. So a technique, as you've just described, using a catheter going up through the groin and into the heart, then uses ultrasonic, high frequency ultrasonic sound to actually burn off and kill some of these excess cells, and it settles down the atrial fibrillation basically instantly.
That's exactly what happened. And one of his doctors referred to himself as the electrician.
Yeah. So it is incredible, absolutely amazing, and just fantastic. The things that are developed out of this research and technologies, you can't help but be impressed.
It must actually be very difficult for doctors to decide which particular style of imaging they want for what they diagnose as a possible problem.
Oh yes, absolutely, and it will depend largely on what tissues you want to examine. So, for instance, if you get back problems, then I'll send you for an X-ray first off and have a look and see if there are issues there. If more detail is required, then you go for a CT scan. And if you want more detail, then of course MRI. And all of this, of course, is done without a scalpel being in sight, which is the best thing. So if you had if there was suspected there was something with the heart, then you may be sent for an ultrasound first off to see if there are any issues that can be detected in that way, or you may be sent for an angiogram to get any pictures. And so therefore, again, dependent on what is suspected, then this determines the type of imaging that will be required in this particular case. Yeah.
Frank, is an echocardiogram the same as the ultrasound?
That's a good question, June, and one that I'm not technologically empowered to answer. Not sure.
Because that's what I've been, or what I had when I had my heart problems. It was called an echo. Well, and then what I have still is checkups.
Yeah, as an echocardiogram.
Echocardiogram is what they call it. Yes.
Yes, it probably is. Yes. Yeah. And this needs to be understood by everyone that an echocardiogram is different from an electrocardiogram.
Yeah.
Okay. Yeah. So with an echo, you're actually looking at the valves and so forth in the heart to make sure they're working okay. With an ECG, the electrocardiogram, you're looking at the electrical activity in the heart. You get that interesting trace that shows loads and loads of information. So yeah, it's quite different. But yes, you're probably quite right there, June. Yeah.
Yeah.
Okay. Last but not least, if you've ever had the urge to look up somebody's bum, which I haven't, but anyway, if you ever decide to look up your own bum, here's a chance to do so. The colonoscopy. Now you might be thinking, wow, you know, this looks so clean. Well, yes, and the reason for this is because prior to the colonoscopy, you're given some gunge to swallow, which is basically like Drano for your digestive system. It cleans it right out of basically everything. And the whole reason for needing to do this is so that the tissues can be examined in detail without any other tissues or a matter being present. So again, these endoscopes come into their own here. They carry their own light source. They also have little instruments so that biopsies can be taken. I did have some videos given to me. I didn't keep them because they were just too uncomfortable, of colonoscopies where biopsies were taken. But I can tell you that what happens is with the endoscope, it's introduced into the body, and if a biopsy is needed, the little thing like a Pac-Man jaw comes out and grabs a bit of tissue and just rips it off. And every time you see that, you go, oh, that's got to hurt. Well, apparently it doesn't. It looks, of course, when you've got a thing that's only less than a centimetre in diameter introduced into the body, and you're getting these pictures, it all looks huge. And so you see these grab things coming out like a pair of tongs, coming out to grab some tissues and rip a piece off. And it just looks incredibly uncomfortable, although I'm told it isn't. I've not had a colonoscopy, but I'm told that the worst part is having the thing stuck up your bum in the first place. But as we can see here, this image, pardon me, incredibly clear. No issues at all with this particular colon. It's totally polyp-free, aggression-free, no cancerous growth anywhere. So this is a fine specimen, and you'd hope that your own colon is in as good a condition as this one. Video camera is attached to the colonoscope, and pictures are taken, obviously, video as well, and it can be used to look at the whole colon. Now, this gives rise to a question about the ascending colon that we looked at some time ago, where the cancer was. This statement here that this can be used to look at the whole colon and the lower part of the small intestine, you would imagine would require an extremely long endoscope. So my information that I've gleaned over the period is that, yes, the rectum, the descending colon can be examined. The transverse colon gets a bit tricky. The whole thing with the intestine is that above the rectum, you've got kind of an S-bend, which then goes into the sigmoid colon. So this, the sigmoid colon and the descending colon. So the descending colon comes down the left side of the body, then goes through the S-bend, a bit like your toilet, and into the rectum. So try to get a flexible tube around those bends through the S-bend, even into the descending colon, would be a bit tricky. So to get it to the transverse and into the ascending colon would be extremely tricky indeed. So I looked at this statement, looking at the whole colon and the lower part of the small intestine. I thought, not in my body, you won't be. It's I find that very, very difficult to acknowledge in real terms. But anyway, there it is. That's what's reckoned. So there we go with it. The colonoscopies, yes.
I know somebody who has at least 2 colonic irrigations for allegedly therapeutic reasons, not for any medical reasons. But what interests me, 2 things. Firstly, do you know anything about them? And secondly, how deep into the lower intestine does that extend?
Okay. Well, I can tell you a little bit about them. If you've ever had an enema, or know anybody who's had one, a colonic irrigation is very, very similar. It works on the same principle. It is only the lower part, really only the rectum, and if you get around to the sigmoid flexure, you'd be very lucky indeed. So it is really the rectum and just the lower part of the large intestine that's actually used or affected in this particular case, and it's designed, as I'm sure you know, to remove blockages, any potential blockages. Now, there are people who have colonic irrigations as a regular feature of their health regimes. I question the need for that. I think that a person who's doing that is probably doing their body a disservice because they're interrupting normal procedures.
Thank you.
Yeah, but they have become quite, what's the word I'm looking for?
Fashionable.
That's a good word, yes, fashionable. Yeah. Oh, I'm going for my weekly colonic. Well, you know, if a person needs regular colonic irrigations, I would then start questioning their dietary habits.
By the view of that image on the screen right now, I'd say that intestinal Drano seems to work pretty well.
Oh, absolutely, yeah. Well, if you, now what's the stuff called? Marcia's got some. Can't remember what it's called. But it's interesting because I have a sliding hiatus hernia. We thought, well, let's see if we can ease the issue there and give the digestive system a bit of a clean out. Well, clean out. Gosh, crikey, Liza! And I only used 1 sachet of it. And apparently, you'd normally use 3. You know, so God, if you use 3. You would never be off the toilet, I can tell you. It is spectacular. Okay, that's all I can say. Spectacular. Yeah. So yes.
Thank you, Frank.
That's a good way of having a really, really good clean out, if in fact you need one. I would certainly, though, be a little bit cautious about just doing that for the fun of it or for the hell of it. But it's an interesting thing to do. Yeah, it did ease my my hernia problem a little bit, but I'm actually arranging some surgery now to have that fixed. So it's a bugger of a thing, but anyway, there we go. So sailing on, and that I believe, yes, it is that. So a little bit of a romp through medical imaging.
Stop sharing then, Frank, for a moment, and we'll put you on the screen for questions.
No problems. Okay.
Okay.
Yes.
Thanks for that, Frank. A rather fascinating view of our inner bits.
Yes, indeed. Yeah.
Everyone can unmute themselves and ask questions or make comments.
I thought it was fascinating, Frank. Thanks.
No worries, Ron. You're welcome.
Could I just say that the more I learn about the human body, the more I can understand people not accepting the theory of evolution.
Thank you, Bob.
The other thing I'd add is I've had a PET scan and a CAT scan. Could I now expect a guinea pig scan and a puppy dog scan?
Lucky.
Yes, indeed. Yeah, yeah, yeah. There was always the joke about the chap who had a sick bird, and he took it to the vet, and the vet said, "Oh, it's not looking good." Anyway, when the guy got the bill, he was quite surprised, and they said, "You know, how come the bill was so high?" And he said, "Well, this is what we do." And he brought in a cat who sniffed the bird and looked up and went, "Nah." Then he brought in a pardon me. What was the other one they brought in? Oh, crikey. There you go. I've lost it. Anyway.
I think nothing like losing the jokes punchline.
That's true. But anyway, the issue was that the bird had had a CAT scan. And so this is why the bill was so high. But yes, as you say, guinea pig scan, parrot scan,
Whatever.
even a Bonnie scan.
Yeah.
Anyway, medical imaging is amazing, and the variation in techniques available is nothing short of astonishing.
Just back to Cole's question about taking calcium. Just wanted to say about apatite. It is a mineral found in igneous rocks, so in granite and rocks like that, but also in marble, in crystallized limestone, as in marble. So they're obviously strong rocks. So it's not surprising that that's what it's doing to your body as well, feeding.
Oh, absolutely, yes. It's not surprising that it's actually used to build bone. Yeah, because bone is pretty darn strong.
Can I just say something?
I took calcium tablets when I was still racing motorbikes, but for that reason.
Yeah, sure thing. Yeah.
Because I was knocking on towards 60 years old and figured that I was going to prang, and might as well give myself the best chance of staying in one piece.
Sure thing. Yeah.
Nearly worked.
Yeah.
Yeah, Jeremy.
Frank.
Yes.
If anyone has to have a colonoscopy, I know you gave a rather horrendous account of it. It isn't that bad.
No, that's exactly right. Yeah.
Know anything about it until you wake up for your free sandwich afterwards.
Yes.
Which is usually the worst part of it, actually. Because the hospital sandwich is not very nice.
But at least it's going to go some way to replacing what's been flushed out of your body prior to the scan.
Yeah, that's not good. Even with the grabbing thing, which I had done, you don't know about it at all until they.
No, that's exactly right. Yeah, when you see a video of a colonoscopy and the biopsy's been taken, it looks horrendous. Yeah. But then you think about the equipment, and it's so small. It's a tiny, tiny piece of tissue being grabbed out. Yeah, so you don't know anything about it. Yeah. Yes.
Well, I'm glad you said that, because I've got to have one in a couple of months.
Right. Yeah. Marcia's had two, and yes, she told me all about them. So quite interesting. But yes, you don't know anything about it at all in real terms. Yeah.
Okay, well, if that's it, thank you, everybody. And next exciting episode is Cole's and my opal trip around Australia and.
Oh, yes.
And opals. So see you next week.
See you next week, everybody.
Yeah, bye.